So let's look at the last of the antiviral case studies that we need to look at, which is looking at HIV and AIDS. So we look at HIV and AIDS as a viral pandemic. So there are a large number of people worldwide which carry the HIV or AIDS infections. This data on this map is actually a bit old, so 2006, and those numbers are likely to have increased. It's important to identify the difference between HIV and AIDS. So HIV is the human immunodeficiency virus, and it results in an eventual diagnosis of AIDS, which is the acquired immunodeficiency syndrome. So you can carry the HIV virus and not have acquired immunodeficiency syndrome, but it generally will progress there eventually. So in the 1980s and 90s, there was a lot of education and panic about the AIDS virus in terms of the number of people who were dying from AIDS and the control of the spread of the disease. So large numbers of education programs were set up, and this has seen the numbers reduce within Western nations. However, AIDS and HIV still remain a significantly large problem in lesser developed countries and through places like Africa. So it's still considered a critical health issue because in places like Africa, about 35% of the adult population are actually infected with HIV. And with that comes the risk of greater spread. So women having children which can carry HIV onto their babies, or after marriage or sexual practices, just basically the spread of the disease in general. So unlike influenza that we looked at before, which had contained DNA, HIV is an RNA retrovirus. So this means that inside the protein capsule, inside the actual virus capsid, there is viral RNA. This is then transcribed into DNA using reverse transcriptase of the host cell, and then the new DNA is integrated into the overall genome of the host cell. So essentially, the virus injects the RNA. This RNA is transported into the nucleus. Reverse transcriptase turns it into DNA, and this is integrated into the overall genome. So this DNA now contains all the instructions for the new viral particles and how the host can produce those particles rapidly, remembering that a virus cannot reproduce itself. It needs a host cell. So the HIV virus will then reproduce using the host cells and proliferate. Initially, the HIV virus actually gains access to the host cell by using the immune system's T cells, which also stops the host immune system from signaling the rest of the body. So because it hijacks the body's own immune system in order to replicate itself and infect host cells, the body's immune system isn't actually recognizing it and targeting it. The proliferation of the virus then destroys the host body ability to fight off infections, and this is where we get AIDS. And it's a result of the compromised immune system that usually results in death. So the disease itself doesn't cause death, but the fact that the immune system isn't responding to infection means that other infections and diseases can result in death of the host. So if we look at it here, this is the HIV life cycle. So we have the HIV virus here, which has the protein envelope. It has the reverse transcriptase actually built into the RNA here. So then the virion binds to the receptor protein, which then lodges onto the cell. It enters the cell, so we have injection of the RNA, remembering the viral capsid itself doesn't entirely enter. We have injection of the RNA. The reverse transcriptase then converts this into double-stranded DNA and integrates it into the DNA within the host cell's nucleus. Then the cell's mRNA transposes this from the nucleus into back out into the cytoplasm, then its protein packages and everything else like that are actually manufactured by the cell's own machinery in the cytoplasm. Then what happens is we get release, assembly of the viral proteins, budding, which then allows the new viral proteins to bud off and be released, and usually in a much greater number. So essentially, there's two main places that we can attack this with drugs, this process. One is reverse transcriptase inhibitors, which actually stop the viral RNA being transcribed into DNA. The other is protease inhibitors, which inhibit the formation of these polypeptides for the protein coat. So let's have a look at those. So there are a number of challenges associated with effective HIV treatments. The drugs themselves have been quite harsh and have quite severe side effects. But again, because they're antivirals, they have very rapid, so the viruses have very rapid reproduction cycles, which means that the virus evolves rapidly and can be hard to nail down with drugs. Also remembering that viruses aren't alive, so there's less ways that we can target them, and we generally have to target them using the life cycle once they've infected the host cell. HIV is particularly good at mutating, and it changes enough to confound the host's immune system so that the host's immune system is not able to battle the infection itself. So this is usually done through the alteration of the protein coat on the outside so that antibodies don't recognize the new generations of the virus. It also is quite difficult to attack because it integrates into the host genome, which means we can't really target the virus without targeting the host cells as well. HIV is an active field, but as you can imagine, as it became more controlled in Western nations and developed nations, funding into HIV research kind of fell down a little bit. There still are a number of active groups and agencies, including the Gates Foundation, that are doing active research into HIV. And these main areas concentrate on reverse transcriptase, so again, blocking that RNA to DNA process, or protease inhibitors. So most of them use a combination of the two to aim for greater effectiveness. And essentially what it's trying to do is reduce HIV viral particles in the blood to undetected levels, therefore allowing the immune response to be better within the host. However, the problem is they don't remove the virus completely, and we have ways that we can control the viral infection rate or the viral rate within the blood, but it does still leave the person carrying the virus. So HIV, just as a bit of a summary, HIV invades the white blood cells or T4 cells. They can mutate rapidly. We use antiretroviral drugs to target white blood cells, which are meant to protect us against other pathogens. So if we're having to target our white blood cells, we're actually reducing our own immunity and our ability to fight off other diseases as we treat it, which is a bit of a problem for patients in terms of getting ill during treatment. It can lie dormant for quite a while, which means that the spread of it, even though it's dormant, it can be infectious, so people are able to pass on the disease without being aware that they have it. There is another aspect to socioeconomic factors to it. The antiretroviral drugs are very expensive, and the access to those drugs, depending on the person's socioeconomic situation, can be quite limited. There are also cultural issues in terms of the stigma associated with HIV and AIDS. In the 80s and the 90s, this was attributed to AIDS being considered a disease that drug users or homosexuals got. And while this was not true, it became socially the truth for a while, and the stigma associated with that meant that people who perhaps did not fall into those categories or didn't want it to be known would not get tested or would not believe that they had the disease. In Africa, there can be a number of social stigmas associated with that as well. So it is very challenging for us to provide adequate treatment if patients are not honest about their symptoms or the possibility of them having the disease. So one of the ways that viruses, as we move forward, are being tackled is, and we've mentioned this earlier, that some of the things like smallpox and things like that have been and polio have been tackled quite well, is through vaccines. We don't have vaccines for all viruses, particularly if a new virus arises. We need to be able to treat it before we can have time to develop a vaccine. But generally, vaccines are delivered as a weakened form of the disease, okay, that may be dead or living and is injected into the body. So essentially, you're exposed to a small amount of the disease antibodies or antigens so that your body can produce antibodies against it. So the body reacts to the antigen by creating antibodies to attack it. And then if the antigen ever enters the body again, the immune system knows how to deal with it. You can see how this might be a problem with AIDS in that it blocks the white blood cells and the T4 cells, which are part of the response system of our immune system. So finding a way that we can do this with a rapidly evolving virus is quite difficult. So a vaccine is not always possible depending on the nature of the virus. Just have a think about this. I know that a number of you probably sit on the yes debate, but it's a good one to think about in terms of the successes we've seen with treatment of viral diseases through vaccines, but there still is a debate over vaccination of children, and we are seeing a rise of these diseases again, polio and measles, in terms of people refusing to vaccinate their children. So we might have a discussion of this in class, but it is an important aspect to think about, and think about how you might educate someone on the benefits of vaccinations or allay their suspicions or worries about the risks or dangers of them, because as we know, there are always side effects and risks associated with medicines. Okay, that's it. So that's it for antivirals and antibacterials. Almost at the end of our option now.